AVS Media Demo.
Program, do we need to continue this program, and so on. Surveys are usually the method to prove that. So if I have money to do a survey, but my colleagues at Concern are doing a survey with a good team at the exact
AVS
time,
Media
I
Demo.
the resources to do that survey. So if there was more data sharing, I think a lot of resources would be better used and be more effective. But that's me.
I'm just curious because I know that there are different organizations.
AVS Media Demo.
Nutrition and getting data from this. So right now, how is it working? Like the indicators are quite clear, but is everybody following the same structure still? Like, can I compare data from, I don't know, World Bank with the data on malnutrition from I don't know who?
So there's certain, in general,
AVS Media Demo.
the recognized, maybe I didn't stress that enough, but it is the recognized adopted by all agencies.
Okay.
So the UN, any UN ministries of health, NGOs, if you're collecting nutrition mortality information, this is the method of choice.
Mm-hmm.
So across the board, it is the consistent kind of way to obtain that information. But then, of course, there's always
AVS Media Demo.
adding too much information, getting too voluminous, but everybody wants their own indicators popped in. And now since it's so simplified and standardized, then the quality is actually more hindered because then everybody says, oh, it's such a great method, let's add food security, wash, this, and then it becomes a survey of a Bible.
So what is
AVS Media Demo.
how many questions is that for one child?
Not even out of 10. But it's not even, a lot of the questions are not even asked to the child versus taking their measurements and asking the mother, the caretaker, some basic questions. You know, measles vaccination.
Yeah, so for each child.
Yeah. But I mean, in general, we don't take more than
AVS Media Demo.
indicators if we're looking at maternal health, or some questions about food security, wash, in terms of their contextualization. It's in general about 10 minutes per household.
Question. When you guys started this process,
AVS Media Demo.
for UNHCR and UNDP, like you said, it took a while. Were you able to have time before you started any programming to actually go through this process? Like, how were you able to work that in?
You're trying to ask me, was there a baseline?
Yes. The simple answer is no. The real answer is
AVS Media Demo.
we as GIPS got involved actually once the TSI had already been initiated. There was also a challenge that it wasn't initiated in one location, in all locations at the same time. There was 3 locations and a little bit more donor interest, and 5 locations, and when they realised that this was something
AVS Media Demo.
we need a serious system here. So we got involved. After that, there was an attempt just between UNHCR and UNDP to figure that out. Didn't go very far, and that's when they had asked for our assistance. And sorry, I should have maybe mentioned that's what we do in GIPS, is help when things aren't working. We're not directly.
AVS Media Demo.
So no, not really, but more complicated, more nuanced answer is that in some locations it was well done in advance.
AVS Media Demo.
So I will start. My name is Christophe.
AVS Media Demo.
Luxembourg, and we're managing a project in northwest of Syria. It's a project funded by ECHO, and we are working with CADER, which is a local organization in Turkey. For sure, we are not allowed to enter Syria, so it's a remote project.
AVS Media Demo.
The objectives are to distribute 6,000 daily food meal, 4,500 monthly food basket, and a few hundred NFI. The location is in IDP camps in northwestern Australia. As you can see, the geopoints are not yet taken, but we are already at the
AVS Media Demo.
The border, Turkey, Syria is just at the triangle. So first I would like to thank the Syrian team doing an excellent work, because if we can speak about it, it's because they are doing the job. Okay, we are just administrative
AVS Media Demo.
layer over them. So you have a kitchen and you have the food basket. Almost from the beginning, we start to do a monthly monitoring, either on food meals or food basket distribution. Why? Because
AVS Media Demo.
what can be improved, and are the donors satisfied with what is done? It's quite important for them. We start with paperwork, Excel sheet coding, summary done automatically or not. And the main difficulties were error in encoding, length of procedures, and analysis.
AVS Media Demo.
Today, we had a training from GeOnG about 4 months ago. We are coding into smartphone. Then they go to a center inside Syria and they send everything by internet to Turkey, where there is an automatic coding into Excel and analysis. Yesterday, someone
AVS Media Demo.
told me, yes, I think that's very good to me, but it's very clear and very easy for everyone. So I checked my Excel sheet, and I'm not sure that it is very easy for everyone. No? Yes, no. And then the result is quite abstract. And for sure there is a difference.
AVS Media Demo.
But what we get is, we have some main results. Are the men hot? Do they arrive on time? Do they prefer food basket or cooked meal? Are they satisfied with the quality, the quantity, and the quality?
AVS Media Demo.
Feedback to speed is immediate. So at once we change the time of delivery, because we start cooking at 8 o'clock in the morning, and meals were arriving at 1 o'clock or 2 o'clock. It was too late for them. So we changed and we started kitchen at 6 o'clock. During summertime, they were asking
AVS Media Demo.
to cool they were asking ice to cool the yogurt and so on. Also, we changed the menu in summer. We do some monthly follow-up, month after month, and we can see the quantity. People in red are quite satisfied. And
AVS Media Demo.
few people say it is insulting. About the quality, you can see the red one starting from 50% going down to, let's say, 80%. So people are not satisfied with the quality. Why? Because it was just the first monitoring done after the training.
AVS Media Demo.
The phones. Diversity of meal. And for the food basket, we do exactly the same procedure, but we are not sure about the questions we are asking. Do we have
AVS Media Demo.
We are speaking about quality. So quality of bulgur, quality of rice, quality of margarine, oil. And it's quite difficult to test the quality and to do some change. Fortunately, for the quality, once we have
AVS Media Demo.
we are not satisfied with the quality of rice, and we went back to the vendor and we changed the brand of the rice. But most of the time, on food basket, we cannot react immediately. So the monitoring is a bit something
AVS Media Demo.
We go, we ask, and we just keep doing what we are doing. Added value, less error in transcription, homogeneity of the answers, and faster processes. Limitation, training.
AVS Media Demo.
We trained 5 people, and the monitoring team was 4 people, and they are different. Because we are in an unsafe situation, and people are moving from one place to another, and we cannot access to the monitoring team. And they cannot come to Antakya, to Turkey either. So we train some people.
AVS Media Demo.
Limitation, analysis. Why? Because the team was very good to do the work, humanitarian work, but they were unable to produce any paper, any analysis. So when we were asking some
AVS Media Demo.
giving us the papers, but they didn't look at it at all. So it was very difficult to do some analysis. On food basket, as I said, it's difficult to react immediately because we have a tender process, it's quite long. We have budget restriction, for sure the people want.
AVS Media Demo.
And we have also to look at the nutritional aspect so as to be within the limit of the objectives of the program. And one of the limitations of the phone is also to remove part of the human contact. When you go to the field with a paper, you can speak to the people and you can have some human relation.
AVS Media Demo.
Phone, mobile phone, or whatever you want. Then you are more with your phone. You're not with the people, you are with the phone. And I think we are losing a lot of information due to that mobile phone. But I want to have a few more slides.
AVS Media Demo.
By Ronde yesterday, or on ethics by Dr. Kala, because at the end, we are making a processus that lasts 3 days in the field, and what do we send to the headquarters? We send just this thing. Okay, it's a very short one. So
AVS Media Demo.
to have so many indicators to follow, to ask so many questions, just to send this to the headquarters, and probably a summary of this is sent to the donor. So I have some questions. I'm moving from humanitarian work to bureaucratarian work. It doesn't exist.
AVS Media Demo.
And we have the limit between Orient and Occident, typically. In Orient, you just speak and your word is accepted. In Occident, you can speak whatever you want. If you don't sign a paper or 10 pages, it doesn't mean anything.
AVS Media Demo.
And there's a difference between a place totally destroyed where people don't have any education almost, and here where most of you have university degrees. So you are able to manage a lot of computers and whatever you want. And shall we start? Shall we keep
AVS Media Demo.
Do you want to do questions? There's no chair. Sorry, we left it alone.
Self-chair.
Do you want to do questions in between?
AVS Media Demo.
Presentations and tell us what you want.
I think it's maybe better if we could make the street presentation and then ask the solution coming.
That was the last word.
Very good chair. Everyone see?
AVS Media
So I'm
Demo.
gonna stand. I know I'm used to training, so if I don't stand, then I may fall asleep. So we're gonna be talking about SMART. I'll describe the acronym and everything, but it is more not the tech side. I'm a nutritionist, so it's a little different. in terms
AVS
of
Media Demo.
the presentation, but this is the data that makes people move. So we're going to look a bit more into how we're going to have a standardized measurement of public health indicators. So we're going to quickly look over our various assessment tools that are used on the field, and then with that information, decisions are then made. How important is good quality
AVS Media Demo.
and how can we use this data for designing interventions and monitoring trends. So when we look at an assessment, I think it's quite clear that assessments are the data makes people move. Decisions are done, interventions are put in place, more specifically to the needs of the population.
AVS Media Demo.
If the program needs to be continued, it is the data that's going to make those changes. When we look at the different methods for data collection on the field, a lot of people are looking at rapid assessments. It's a quick and dirty way to collect a lot of qualitative information, focus groups, okay, what is happening more or less so we could immediately intervene. But then you need
AVS Media Demo.
then you need to be representative. So then cross-sectional survey comes into play. Okay, so it's the quantitative, statistical probabilities, all of this. And those are the things that will assure longer-term interventions are then put in place or resources are going to be scaled up or scaled down. And then
AVS Media Demo.
surveillance systems are put in place where there's a continuous collection of data to monitor the trends. They'll be much more succinct in terms of the information collected, but the quality is still a big issue. So what is SMART? It's a great acronym, endless puns. It stands for Standardized Monitoring and Assessment.
AVS Media Demo.
So it is the way to collect with household population-based surveys these information in terms of nutritional status and the mortality rate. The two big indicators, not only for donors, but pretty much for any program to be put in place. So it's very standardized and simplified.
AVS Media Demo.
That you don't have to be a big epidemiologist with all these degrees. You could run a SMART survey. Okay, after being trained, if you want to self-teach yourself with a manual, which is quite daunting, but you could self-train yourself and run the SMART survey. This methodology is at the basis for what Paul Spiegel yesterday with UNHCR, with all
AVS Media Demo.
WASH, mortality and nutrition, this is the core of all those assessments. Because it's standardized and simplified, but above all, it has a huge importance on the quality. And that's how UNHCR was able to do quality rankings. So they had, yes, very good, we could confirm and
AVS Media Demo.
or we can't be, which is a big thing. As much as we collect all this information, how do we ensure the quality? So when we look at this, we have the representative, accurate, and precise estimates of these key indicators. And it really stands on the best available validated data. So it's not easy to do
AVS
something,
Media Demo.
but if you follow the steps, then in general, you'll always collect good quality information that you can be confident. So some key smart innovations. So we have the NS software. I'm going to jump to the NS software and show some automatic functions that it does. Sample size, which I'm not going to enter here.
AVS Media Demo.
Sample size is a bit more flexibility. You don't always have to measure 900 children, as they were doing before. Sampling and the plausibility check. The plausibility check is a very transparent way that people can validate or unvalidate information. So it's a very powerful tool. And unfortunately, with more and more data manipulation,
AVS Media Demo.
this is a great tool that can actually detect if people are cheating or not. So if we look at the software, what we do is we compare the information, so our main indicator, GAM, global acute malnutrition made for height. So we could compare it, we wanted to
AVS Media Demo.
nice green curve. So we have good quality data, okay? If we look at other curves, it might not be as normally distributed, so it's based a lot on the statistics. And this way we could objectively evaluate how good of a job this person did in terms of the survey. Can I trust this data or not?
AVS Media
When we
Demo.
look at then the plausibility check, we have a full overall data quality score. So based on statistics, it's going to analyze in depth your nutrition information and say, okay, overall, did we do a good job or did we not do a good job? Can we trust this
AVS
information or not?
Media Demo.
Okay, which is du jamais vu, it's innovative, this has never been done. Also, in terms of mortality, we have directly the crew death rates in terms of the indicator. We could also change what intervals, what population we want, and it automatically provides us the results. So it
AVS Media
facilitates
Demo.
the tedious field data collection in a very transparent and quality-focused manner. When I make that, share my presentation. Sorry, I'm jumping forward. It really does stress the standardization of methods on the field, that if a person
AVS Media
does a
Demo.
survey, you know these steps are going to be outlined and it's going to be very transparent on not only the difficulties on the field, but also the quality overall of their data. And with consistent and reliable data, then we know we could then follow trends. We know we could scale up or scale down with confidence with this data.
AVS Media Demo.
So in terms of some data mapping, I know everyone loves histograms here, so I thought I'd put this in. So if we could now map the prevalence across Western Central Africa and also the levels of confidence. So we often have the confidence levels.
AVS
We also
Media
use
Demo.
smart for detection of trends over time. So these are, each data point is a survey, and we could see if overall we are increasing or decreasing in terms of our main indicator here, which is global acute malnutrition. In terms of the key challenges, what we've been discussing over the past few days,
AVS
in,
Media
quality
Demo.
out, garbage in, garbage out. Here it really focuses on getting first that good quality for that data so that if it can be shared, which would be amazing, then I strongly advocate to share this information, although it's not easily shared, then better interventions can be put in place. Updated maps of rural
AVS
zones.
Media
These are
Demo.
advocacy points to the cartographe and everyone in this room in terms of rural zones and displacement. How do you update this? I was amazed with OpenStreetMap that you could call on requests and do this, because right now, this is how we do it in the field. We do our sketches, we say, okay, how many households?
AVS
we map
Media
out the
Demo.
areas that we have to survey, you know, very rudimentary estimates, and this is what we deal with now on the day of the survey. If we had more information, how many buildings, you know, if there's apartment buildings and everything, this would be amazing. So anyway, small advocacy point.
AVS Media Demo.
In terms of ownership and the sensitivity of malnutrition data, malnutrition and mortality is very sensitive, and it could, if poor quality, determine whether there's famine or not famine. It's a huge political undertaking consequence. So how could it be, first of all, shared across
AVS Media
right now,
Demo.
it's not. But if we have GIS and the prevalence, can we even know what's happening at sub-regional level? Would that make sense? So a couple points there. And lastly, in terms of what we do at Action Against Hunger Canada, so we are the SMART project conveners. We discuss with the technical advisory groups, the experts, not me,
AVS Media Demo.
and how we could facilitate its dissemination and diffusion in terms of training tools, technical questions, website, and so on. Oh, we can question after.
AVS Media Demo.
Okay, so
AVS Media Demo.
Quite a nice order, because we've gone from remote managed assessments and really challenging, both politically and also in terms of communication issues and capacities that our first panelists were talking about, to exploring new ways, exploring better ways to manage
AVS Media Demo.
and essential humanitarian indicators that can be standardized. To me, where I'm going to talk a little bit about things that I think can't be standardized and the, let's say, coping mechanisms that GIPS has developed in terms of building consensus around the selecting of indicators for monitoring durable solutions to displacement.
AVS Media Demo.
In some ways, further steps along the line. I work for an interagency project called the Joint IDP Profiling Service, where we work with global partners, but mostly in
AVS Media Demo.
contexts. I don't know how many people here are working in IDP contexts or in different sorts of operations and groups, but that's the majority of our experience, and we're working often in protracted situations. So where displacement is either, where people have been displaced or communities have been displaced for a long amount of time, or there's ongoing
AVS Media Demo.
multiple years, sometimes even decades of conflict and displacement. So talking a little bit about how we both assess, or as I would say, profile, durable solutions. So to what extent are people still in displacement, suffering from the needs associated with their displacement?
AVS Media Demo.
Durable solutions or sustainable solutions. To what extent we can analyse this collectively, agree upon the indicators that are relevant for that analysis is not an easy task. And then to what extent can we monitor that progress over time? And we're going to talk a little bit about that from the experience that we had working with UNHCR and UNDP in Colombia.
AVS Media Demo.
A little bit the structure of the brief talk. Which I'll just share. So the problem statement, why is durable solutions contrasting to GAM and nutrition type indicators and issues, or even to food security ones, to
AVS Media Demo.
more complicated, or sometimes more complicated, because durable solutions is a conceptually challenging issue to agree upon. What is a durable solution for one IDP versus another IDP might be totally different. What is durable solutions for IDPs in urban contexts will be very different from those in rural contexts.
AVS Media Demo.
What is durable solution for IDPs caused by ongoing conflict might be very different from those in a natural disaster situation or after a natural disaster situation. So it's a complex issue, difficult to standardise in many ways. Inherently, many actors are involved because of the complex nature of durable solutions. You have lots of different expertise, lots of different engagement.
AVS Media Demo.
Humanitarian development, but it's obviously, as everyone here knows, more complicated than that. And it's also slow. Durable solutions aren't reached overnight. Monitoring, and therefore, when do we monitor, when do we update, how often do we need to invest in those types of resources are not straightforward.
AVS Media Demo.
So the experience in Colombia and how did I end up involved is in relation to a project called the Transitional Solutions Initiative, which is a big global UNHCR UNDP initiative piloted in Colombia and another couple of countries, where they're looking at trying to kind of demonstrate the structure.
AVS Media Demo.
Where they're looking at, okay, there's over 5 million potentially maybe IDPs in Colombia. That's too many beneficiaries to target our little programs towards. So we select a few communities, try to make those communities roughly representative of the different types of locations in Colombia, some urban, some rural.
AVS Media Demo.
Some returning communities, some relocated communities, and some communities looking to locally integrate, usually in the urban environment that they're in. And to work with those communities, outline a roadmap, as they call it, towards durable solutions. What does this community here need to make a situation better?
AVS Media Demo.
So I'm highlighting this because it's very context specific, even within the logic of one program. These community developed roadmaps for solutions, which in some places might be mainly focused around issues around land, in other places are mainly focused around issues around livelihoods and training in these areas, just to give you two different examples.
AVS Media Demo.
The purpose of this is to inform policy so that the government of Colombia, which as many people will know is a hugely capacitated and very, very competent and actually quite rich government, can therefore take these, inform the policy and implement it, and the approach much more widely. I highlight this about the project because it makes the
AVS Media Demo.
how we're monitoring and demonstrating the evidence of how it worked in this community, how it worked in that community, and how it didn't work in this community becomes even more crucial because they're actually looking at, I think it's 60,000 beneficiaries out of potential, I think the database now is 5.7 million, but I've got some questions about that later. So this was
AVS Media Demo.
and GIPS got involved because they have difficulties in exactly this question. What indicators should we use to monitor this program? What indicators does UNHCR and UNDP have interest in? What indicators would the government have interest in? And then the ultimate, goal of
AVS Media Demo.
inform their programming and policies over the next few years. And GIPS was asked to help in this area of the project to help to systematize or harmonize the indicators that were kind of flying around at the time, and also in relation to the MV process as a whole. I'm going to focus just on the indicators because
AVS Media Demo.
Initial challenges were what's a durable solution, as I mentioned. There was a big focus on finding that answer before even choosing an indicator, which was a really, really difficult kind of negotiation issue. There was the inherent issues in monitoring durable solutions.
AVS Media Demo.
The main issues were around the interagency nature of this project. UNHCR had to report on certain indicators, UNDP had to report on certain indicators, the government had certain indicators, they spoke about indicators in different languages, especially UNHCR and UNDP. They have different approaches to support durable solutions for the same population.
AVS Media Demo.
All of that together and get a system that is working in one. And then another, hence why I showed you this picture before, initial challenge was the TSI logic. How can we get something that works for a roadmap for a specific community's solution?
AVS Media Demo.
Conceptually and concretely and substantially different from another, but at the same time, how can we compare what worked here and what worked there, what didn't work here and what didn't work there to inform the ultimate goal of policy development. So the outcome was, and as I said, I'm going to go in and focus on the indicator part.
AVS Media Demo.
I can speak more generally first. The outcome was maybe no rocket science here, but a core set of indicators that would be monitored across all locations, and then flexibility and guidance developed for locations, not only to contextualize those. One's indicator or one thematic area might be relevant in this process.
AVS Media Demo.
And finding the right indicator, as they call it in Colombia, battery, took months. It took months, and there was a number of ways in which through, you'll see that we tried to overcome these differences. First of all, the
AVS Media Demo.
looked at was linked to three different levels. It was linked first of all, or structured first of all, at the community level. So that being one TSI community. Now there are 17, I think there are now 19, but 17 different communities selected for the project. At the community level, looking at the TSI
AVS Media Demo.
and looking at the plans of action, which is that community's plans of action. We need X, Y, Z for to achieve durable solutions in this context. They were community developed priorities. That was the basis for structuring the indicator battery, and how we selected which ones
AVS Media Demo.
relevant and which ones were not. It also looked at the national level. So the victims unit in Colombia has returns and relocation plans, which also has certain indicators, returns and relocations being the two solutions that they're interested in from the government's perspective. There are obviously others, hence
AVS Media Demo.
to match it to the types of data systems, the types of monitoring, the types of assessments that the government already have planned. If anyone's working in Colombia, you know that it's quite difficult to change a plan that the government has already put in place. Even if it's one question on form, it's rather difficult. So merging your more flexible ways of working to theirs.
AVS Media Demo.
So feeding that in then to these national return and relocation plans, and at the same time taking the GAS framework, I don't know if anyone knows the GAS framework, which is internationally recognised what is a durable solution for an IDP, and lays out a number of different criteria of which we can, at the global level, kind of
AVS Media Demo.
on the right track or not in relation to solutions for displacement. So it was structured according to these three things: to do the advocacy, to inform the government, but to also make sense for the community's action plan specifically. Secondly, the multi-level monitoring approach. We had many challenges.
AVS Media Demo.
Are we oriented to the beneficiaries? Are we oriented to the donors? Or are we oriented to our own headquarters, which is kind of a little bit mixture of the last one there as well. Designed a system that had complementary indicator types, looking specifically at the assessment of the impact in the communities. Okay, so household and individual data, mostly
AVS Media Demo.
community level indicators too. Looking at institutional policy impact, that was also at the local level and at the national level, kind of to reflect the different structures within the Colombian authorities. And more straightforwardly looking at performance indicators, so activities delivered, etc. The indicators
AVS Media Demo.
as I said, there was a long process through a range of different workshops to use the structure that I just described and the, let's say, more standard, measurable, relevant, etc. assessment of the actual indicators themselves. A series of workshops to agree upon the battery. I love the word battery. I wish we used it.
AVS Media Demo.
Of the indicator battery. We reviewed a huge amount of existing indicators in use in Colombia, but also kind of global standards, sphere standards, etc. The primary ones considered were UNHCR's existing results framework, UNDP's existing results framework, the main two implementers of the project.
AVS Media Demo.
Of the money that was coming in. The donor was Canada, and Canada loves indicators, so there was also a huge set of donor-related indicators, in addition to what we had to report to the headquarters on. Most importantly, the
AVS Media Demo.
very comprehensive set of indicators focusing on internal displacement. That's the National Department of Planning. In addition to that, the government's victims unit, specifically in relation to durable solutions, and the indicators looking at there. And then lastly, the results framework. So we had this huge kind of swimming in indicators situation, and through workshops managed to narrow it down by structuring it.
AVS Media Demo.
Main actors throughout the process. It took some time. And I don't speak Spanish, so you can imagine. Manageable disaggregation. This was one of the most, I suppose, challenging parts to get agreement upon and limit. Only collect data.
AVS Media Demo.
It also applies to only disaggregate data that you need to disaggregate. And this was a little bit of a challenge working there because let's just say the standards of data collection in Colombia are not something that the international organizations can keep up with. It's huge.
AVS Media Demo.
Timing and methods. And this was one challenge too that I highlight specifically because it was a humanitarian and development actor collaboration, because of the need for reporting on a much quicker basis on UNHCR side compared to on UNDP side, where the
AVS Media Demo.
and the logic of the approaches, etc., are a little bit more flexible in terms of time frame. Won't get into the data collections now, the data collection methods now, but it was also an important element for selecting indicators. Is okay, how can you fill this indicator, and do you have the resources? Do you have the need to do it in that way? If not,
AVS Media Demo.
so it was a range of things like this. So this is just a little snapshot of it. It was bigger than this, obviously, where we had it linked to the TSI project, linked to the AST framework. For some reason, I deleted the government because it's a slide from a different presentation. Sorry. Linked to the government's plan of action.
AVS Media Demo.
Area having impact, outcome, output, or maybe your different organizations call them slightly different things. They definitely did in Colombia. And there's specific indicators or specification of the indicators coming under that. I can share with you the whole table as well if you're interested. So it's a difficult exercise. The main message that I'm trying to say here is when you're not talking
AVS Media Demo.
don't work in nutrition work, but often hearing of the exciting new tools and new approaches for indicators that can be standardized. Nutrition is, malnutrition is malnutrition wherever you are. At least my ignorance for subjects tells me that. But a durable solution is never a durable solution, the same in one place or another.
AVS Media Demo.
Something smaller, for example. So the main message I want to say here is when you're working on developing of indicators for something like durable solutions or durable solutions monitoring, the importance is reaching consensus at the beginning, and that's a difficult process, and that's what shapes the indicators, and that's what makes the project work, yes or no. So yeah, a little bit
AVS Media Demo.
going forward, in case my presentation is interested in you. We are working based on the work in Colombia, but many other countries too, working on trying to standardize this so that there's a package, an agreed upon global package of package meaning indicators, but also the approaches to
AVS Media Demo.
for durable solutions profiling or durable solutions assessment in this case of context. And I will stop there. If you're interested, I'm more than happy to say more about that.
AVS Media Demo.
I think everybody is probably really jealous of nutrition because it is so easy to the indicators are set and but you
It wasn't.
but you mentioned at the end one of the difficulties or one of the challenges is getting data from the organisation.
AVS Media Demo.
We plan to have a centralised repository for worldwide nutrition data, or is that just
I would love one. We even have difficulty with people we've trained to get that information from them. Even after you create a one-to-one basis, but due to the sensitivity, the national ownership of data, or just agencies not wanting to
AVS Media Demo.
how if they do a good work to share it. But I think there's a lot more kind of overbearing barriers to sharing nutrition and mortality information, unfortunately, that as much as a central repository would be my dream come true, right now it's not. There is the CDAT, so Complex Emergency Database.
AVS Media Demo.
Institution at UCL in Belgium that was a database, but it's lost a lot of momentum. And what they were doing was mainly collecting information based on the survey report, which I don't remember which presentation. A report is something, but if you want to know the quality, you need the data set. And it's usually getting the data set.
AVS Media Demo.
Because a report, they could say they did a fantastic job in the report. They could say they did a bunch of things, but until you see the data set, then you can't objectively interpret the quality.
I understand I understand the political problem with sharing data.
AVS Media Demo.
But between NGOs, which can be limited and we can sort it out so that we don't share the info outside, why do you think there is such a barrier?
I think a lot of people first of all, even internally, in terms of one agency, most often central repositories don't even exist. concern.
AVS Media Demo.
Very good as well, but many agencies, like Save the Children, don't even have one, for example. So I think that's like step one. But then talking within agencies to share data, even at a country level, to say, hey, concern, did you just do a survey in that area? Can you share the information? Either no answer or not say it's concern, but
AVS Media Demo.
but also the reluctancy to share. I really don't understand why, but unfortunately that's the case. If there's easier ways, I'd be more than happy to discuss it. If the brains in this room had other ways we could overcome this barrier, but right now.
AVS Media Demo.
Data sharing agreement with everyone is sometimes I think really cumbersome if you just want one bit of data.
It would be quite cumbersome, but I think overall it would save a lot of resources, because now what's happening is for the donors, getting back to presentation one, surveys are often the method of choice.
AVS Media Demo.